been muted just to make sure that we don't have any background noise and things run smoothly. So the recording has just begun. We will also have a discussion period at the end of today's session, but if any questions or comments come up throughout the presentation, please feel free to type them into the chat box. It is being monitored, and we'll make sure to get to those during the discussion. That also includes if you're having any trouble hearing me or anything like that, please do let us know so I can correct that throughout the presentation. The other thing I'd like to acknowledge is just the fact that a lot of work went into today's presentation and the resources that we will be reviewing. A huge thank you to our advisory group of caregivers who are working caregivers and employers who provided advice and input, which really helped to support the development of all of this work. Also, a huge thank you and acknowledgement to the Canadian Mental Health Association Ontario Mental Health Works for their ongoing collaboration on our Caregivers in the Workplace initiative. They also made today's session possible, so thank you. And I think this is a good opportunity to pass it over to Leroy Milton, who will introduce himself and tell us a little bit more about the Canadian Mental Health Association and Ontario Mental Health Works.
Thank you, Felicia, for the warm welcome and the land acknowledgement of the kind words. Welcome everybody again. We appreciate you for being here and you're partaking in this toolkit. It's been a huge work in progress. It's taken a lot of time and a lot of effort from all of us to get this toolkit to you folks. So it's fantastic to finally see this come to fruition and to be able to put this out there for folks that need a toolkit of this capacity, of this kind. As Felicia said, my name is Leroy Milton. I work at CMHA Ontario within Mental Health Works. So it's a social enterprise within CMHA Ontario. A little quick brief background, at least within of CMHA Ontario. It was founded in 1952. We have about 28 branches across the province, across Ontario at least, but we're across Canada, of course. We have CMHA National. And employing over 4,000 employees just in Ontario alone. Now, we work with branches to inform policy, planning, service delivery across Ontario to really provide reliable, current, and accurate information and analysis when it comes to mental health challenges, problems, and illnesses. Now, more specifically within my team, I'm a team of 4 people. We work specifically within a social enterprise called Mental Health Works, which is down there at the bottom, which is really part of a nationwide workplace mental health initiative. So we really focus on workplaces and organizations, whether it's for-profit or not-for-profit businesses or agencies. And at Mental Health Works, we provide workshops to train employees and people leaders, management on awareness, intervention, and prevention skills when addressing mental health concerns specifically within the workplace. So some of the modules that we have, just to give you a taste, is things like stress and anxiety as it relates to the workplace. More commonly, we're seeing stress and anxiety. More commonly, we're also seeing mental health and remote work, or telework, as some folks like to address it as, right? So we have a whole grouping of population that is remote working or teleworking from home. And there are a whole lot of mental health stresses along that we actually address and talk about from an organizational, from a workplace perspective. Another one that's really prevalent, or one that's really used with it for us or asked of us, is a people leader mental health training initiative. And so all of these kind of workshops are built to really, build awareness, build capacity, and give folks, organizations, nonprofit and for-profit businesses the ability, the capacity to really broach these difficult, challenging conversations with employees and to build a solid mental health framework from the bottom up, essentially. Felicia, if you could switch over the slide, please. And then really turning over to thank you, Felicia, and really turning it over to an additional resource that we offer, kind of a soft pitch, so to speak. The CMHA offers a program called Bounce Back. It's a across Canada program. It's a program that's free. It's rooted in cognitive behavioral therapy, really for anyone over the age of 15. So this is outside of mental health works, but it's anyone over the age of 15. So basically anyone legally able to work, dealing with mild to moderate mental health challenges. And it's a program that's a skill building program, really, that gives you workshops, a toolkit, guidebooks, and the help of a coach to help you sort through, deal with, help the participants at least sort through, deal with those mild to moderate symptoms, signs and symptoms of depression, anxiety, etc., etc. And so it's accessible to anybody. You can ask a physician referral if you have a family doctor, or if you have a specific physician, you can ask them to refer you directly. But the great thing about this program is that you can also self-refer. So the documentation is on there. We can send you the actual full workshop, or the full leaflet after, but you can self-refer as well. And so really it's going on the website and just putting in that you're self-referring. And all we really ask of the program is just to have a physician, any sort of physician, whether it's a doctor or a nurse or whoever, to oversee it, just in the event that something happens, or if we get into a topic, or we broach into a topic where we need a physician. And so it's a great program, again, rooted in cognitive behavioral therapy, using workbooks, using online videos. And the best part about it is that it's free, and you get a help of a coach to kind of guide you through the program step by step. So that's kind of a soft pitch for Bounce Back as well. And I think it's fantastic. I've used it as well personally. And it's a resource that I, always kind of refer to and go back to. So if it's you, anyone else as participants on this webinar, but also if you have folks that are on here, family, friends, etc., people that may benefit from this program, you can definitely refer them out, and it's fantastic. That being said, that's me. I'll hand it over back to Felicia.
Thank you so much, Leroy. It's good to have a really good overview of the organizations involved, and then some things we can refer back to when we get into our strategy building as well. So a little bit about the Ontario Caregiver Organization, or as I'll refer to it throughout the presentation today, OCO. We were established in 2018, and we are an independent nonprofit funded by the Ontario Ministry of Health. We truly exist to support Ontario's 3.3 million caregivers. And one of the ways that we do that is being their one point of access for information, so they can find the support that they need. Our mission is really to look at improving the caregiver experience across our province. And our vision is that all caregivers in Ontario will feel supported and valued. So I'm sure you can see, hearing from Leroy about the work he's doing and what the work we're doing at OCO, it really made sense for us to come together today and look at how we can support caregivers in the workplace, as well as the employers, and how we can build some strategies and awareness together. So the focus for today is really to build more understanding around caregivers in the workplace. What does this look like? Why should we care? What are the issues people are facing? What does caregiving actually mean? And then also to build some more strategies for developing policies, practices, standards, and expectations around support, how you can support caregivers who are on your staff teams, how you can support each other as colleagues, and then looking at how that truly benefits the workplace as a whole. So these are some of the things that we really hope you take away after today's session. And at this moment, I would like you just to take a second and think about what comes to mind when you hear the word caregiver. What does that mean for you? You can type it in the chat pod if you want, and you want to join in and be collaborative, or just kind of think about it to yourself for a moment. So you hear the word caregiver, what's top of mind? Okay, so I'm seeing a partner in care, part of a loved one's care team, person taking care of others, taking care of elderly mothers, supporting. Great. Assisting someone else. Thank you for sharing that. I also noticed that someone mentioned they're having trouble with sound, but it appears that others can hear us right now. So hopefully that improves for them. So many of you really hit it here with, what comes to mind for you for caregivers. And so what we're talking about is ordinary people who are caring for their family members, partners, friends, even neighbors. And the people they're caring for have physical and or mental health needs. A lot of the time in my work when I'm discussing this with people, something that they think of is parenting. Parenting is a form of care, or like others mentioned, caring for an aging relative. But this really goes beyond what you would see as a traditional relationship and the roles within that. It really is, if there's an illness or a condition of some kind where a person that you care for really needs that ongoing support. It's also important to note that each caregiving experience is incredibly unique. So everyone has a different situation and can run into different challenges and have different expectations in their caregiving roles. And also the timing could be different depending on the situation. So for example, if you are caring for a spouse who had an accident of some kind, they may have a plan in place where things will improve for them. It's more of a short-term caregiving role. In other situations, you might have a family member or a friend who is very ill and will require care on an ongoing basis throughout the course of their life. I want to share an experience here because, as I said, many caregivers and employers have come together with us to build this. And so it's important to kind of understand some of their experiences. We have a caregiver named Jennifer who came forward very early on, even before my time with the Caregivers in the Workplace initiative, and she shared her experience. So she is a full-time working mother, and she is caregiving for a child with intellectual disabilities, as well as a child who has a brain tumor. And so that's just one example of how you can take something like that traditional parenting role, and now there's caregiving also on top of that. And so this is the type of thing that many people can be experiencing, all while trying to work and make a living full time as well. It's also important to note that not every caregiver will actually call themselves a caregiver, right? So sometimes people think, I'm just doing what I should do. I'm caring for the person in my family or my friend, and that's just what I'm supposed to do. And they don't always come forward and say, hey, I'm a caregiver. So part of this is also building the awareness, not only for employers, but for many of your employees as well. And to give you a sense of what this is looking like in regards to numbers, like really add that perspective, we know that caregivers make up 35% of our Canadian workforce. And so that should be a little bit striking when you think about it. And I would encourage you also to right now think about your workplace. How many employees do you have right now? If you've got 30 employees, chances are 10 of them could be caregivers as well. If you've got 100, we're looking at maybe close to 35 employees within that staff team could be caregivers. So it's nice to kind of connect that and understand what that might look like for you and how it could impact your workforce. So now we have an understanding of what we're referring to when we say a caregiver or caregiving. So what is the issue, right? Like, why should we care about this? And one of the reasons is because this creates a balancing act, right, for the caregiving employee. So when you look at both sides of this, just think about everything that we're working towards in our workday, things that are important for us in our career. And then on the other side, it's that important caregiving role for the person that means so much to them or the person that they need to provide care to, right? So all of these things and just trying to figure out how do you make room for it all and do a good job in both areas of your life. The other thing is we know that 31% of caregivers are actually providing more than 10 hours of care per week. So again, think about your work week. There's not always a lot of time left over when you finish work at the end of the day. So now add on 10 or more hours per week where you are providing that care. We're very lucky at OCO. We have the opportunity to do an annual spotlight report, and I'll make sure that you have access to all of this later. But this is one of the ways that we're able to engage with working caregivers and other caregivers as well to gain a lot of these insights and information. And what we've learned in this past year as well is that 45% of those working caregivers have reported that they're having a really hard time and that they are finding it stressful to balance all of these things that we've just gone over. And about 35% of them are really worried about losing their job most days because they're finding it hard to fulfill all of these responsibilities. So, what an enormous challenge for them as they work through this and really try to show up for all of these areas within their lives. The other thing that we're going to start to get into a little bit more are the impacts on mental health, but also the dynamics within the workforce. So if you think about, if people are feeling stressed and they just can't seem to keep up, they're not sure if they can go to their employer and colleagues and talk this out, what happens? Well, you end up with stigma. You end up with some mental health challenges, guilt, shame, all of these things adding up. Now, this, of course, could also then lead to some workplace conflict. So what I've learned from people too is that sometimes they feel like their colleagues, if they're not understanding like what's going on for them in their caregiving role, they're not always able to be there for them and kind of help support, pick up the slack here and there, maybe kind of come up with some strategies together because they have no idea what's going on. So then they start to see some conflict in the workplace as well. The other big thing that comes up a lot when we're speaking with caregivers are financial concerns. Not all elements of care are covered, or affordable, depending on what the needs are. So this just gives you a sense of what this could really look like for a caregiver who is in your workplace. So of course, again, like we think about the impact on the person, we think about what people could be facing. So what is the overall impact for everybody? Well, these are some of the things that we've been learning. And there is a really great research report that was done by Dr. Samir Sinha and his colleagues. And that's one that we really rely on as we created our guide and some other resources. And again, this will all be available to you to check out later. But what they found is that we have a lot of really highly skilled and knowledgeable people who are leaving the workforce because they feel like they have no other choice as they balance their caregiving role. So this is what struck me the most when I really started to get into this work. 157,000 full-time employees across Canada exited the workforce due to caregiving pressures. Just think about all of those highly skilled people walking away from the workplace. And then 1.3 billion is estimated to be lost in workforce productivity. Again, if people aren't feeling supported, if they don't have what they need to balance these roles, this is what we're looking at. And then combine that with, everyone worries about absenteeism in their workplace. Whether you are a large corporation or organization or you're a small business or organization, absenteeism is going to affect your workplace. And so we're seeing people who maybe if they've, used all the sick days available, now they're getting into unpaid leave days, or they're taking all of their vacation just to provide that caregiving. If you don't provide paid leave, then you're seeing people calling in sick more often. Perhaps, you're going to start seeing some turnover, which again, that could be really straining on everybody, including leadership, as you try to fulfill these highly skilled roles. And I know we also went over some mental health challenges, which can be very worrisome for the individual as well as the workplace as a whole. So I'm sure when you see COVID, some of you might be having a reaction. I know that there's a lot of fatigue associated with the pandemic right now. We've been going through this for 2 years and talking about it for a very long time. And I know many of you are currently building out all of your strategies for what this is going to look like for your workplace moving forward. Whether you're an essential service and you never stopped working and showing up to the workplace, or whether you had to transition from a physical workplace to the virtual environment, this is going to affect you. So what's really important is to understand what the caregiving experience has been through this as well, right? So how it's affected everyone, but then today we're going to look at what are caregivers saying about how this has affected them during the pandemic. So 52%, so just over half of caregivers did say that they're finding it more difficult to balance caregiving and work during the pandemic. And 60% said that that employers were somewhat accommodating throughout all of this, and they're very grateful for that. But less than 20% of employers are reported to have an official policy for caregiving. And so now that workplaces are reviewing policies and procedures coming out of this pandemic, we can really learn a lot from what worked well and what didn't for all of the employees rather, and start to look at how we can support people as they adapt to yet another changing work environment. Maybe it'll mean going straight back into the workplace. Maybe it's a hybrid of both working from home and working in a physical space. As you explore all of this, really start to think about how do caregivers fit in? How is this going to impact their health and well-being as well? And another interesting finding was that caregivers during the pandemic were actually less likely to alter their hours or call in sick this past year compared to previous years, because many of them did find that there was a little more flexibility with their working hours if they were indeed able to work from home and balance caregiving. So learning outcomes like that could really support us in the decision making moving forward. The other thing is we have to think about, okay, how is this benefiting employers, right? When you start to look at learning more about the caregiving employee, understanding what could be helpful for them. Now, it's very early days in the research for this. And as you know, our recent employer resources have just come out. So we've got a lot to learn as people start to try and implement some of these strategies. But what we know so far is that for workplaces that have started to create a more caregiver inclusive workplace, they have seen some increased productivity. Some of the employees have self-reported that they feel like they, have more improved job satisfaction, improved mental health. So all of these things, I'm sure many of you have implemented other strategies in the past, especially around mental health. So if you think about it, did you start to see higher rates of retention? Did you start to see some cost savings for you? Because now you don't have to keep going back into the job market and hiring and training staff if they feel supported. So these are just some ways that you as an employer or even as a colleague of a caregiving employee could start to see some benefits as well. Now, one thing I wanted to bring forward was that when we were promoting this event through social media, a caregiver made a comment and they said that they were incredibly grateful because their employer has always been very supportive of them and finding solutions together as they balance their caregiving requirements. And they said, you can really make or break a person. And that struck me when I saw that. And I was so grateful that they said that, because that's just one example and one person. I realize that one experience, but it's true. You really can make or break a person on your staff depending on how you're able to respond to their experiences. So now we're going to get into what you can actually do as an employer. And we're right on time. I'm just doing a check, so that's wonderful. So let's backtrack for a second. What we've learned so far is what we're talking about when we say caregivers. We are getting more of an understanding of what the caregiver experience looks like across Canada, across Ontario. We have more of an understanding of why we need to do something about this, why employers, need to start looking at what this can mean for their workplace and how they can support. So now this next part of the session is going to be getting into those strategies that I keep referring to. And I'm sure you're like, finally, let's get into this stuff. But what I'll do is just quickly take a look at the chat. I just want to see if there's any questions or anything yet. Okay. Okay, looks like we're good so far. Again, if you have any questions or comments as I continue, please feel free to jot them in there so we can get to them in our discussion. So when you think about this challenge that's arising within the workforce and how it can, really impact your day-to-day and long-term planning, let's not think you just got to jump in and do everything right away. You really have to start somewhere with this. Now, some of you have already started building some strategies. Some are brand new to this and just trying to figure out what this could even look like. So here are some key things that you can start to do. You can, number one, start to identify some caregiving within all of your policies and procedures you currently have. You don't always need to create a very specific, one caregiver policy or way of doing things. It's about looking through everything and saying, how would this impact our caregiving employees? How can this be more supportive of them? How can we be explicit about how we support those who are caregivers within this workplace? You can also start with something like staff awareness and training. So I'm going to be talking through some templates and supports that we offer and have available for you to start this conversation. This could mean that, if you are a leader within your workplace or an HR professional, it can mean starting with the management team and talking through, what they're seeing, gather some insights, and then go into the employees, right? So there's a few different things you can do there for awareness building. You can also look into your benefits programs if you have them. I know not every workplace does, it depends on the sector and the size, but if you do offer benefits, is there anything there specifically for caregivers? Could there be some work-life balance days that could be suitable for everyone, but also benefit some of those caregivers who need the extra time to take someone to an appointment, to look after some of their physical health needs, things like that? Could there be broken schedules, job sharing agreements? A lot of people will look into ways that they can go part-time or have a more flexible schedule where they start at a certain time in the morning, take a break in the afternoon so they can take care of any of the caregiving needs, and then come back to work again, whether that's online or in the workplace later on in the day. So there's all these different things that we can look at, and you can start with something that makes sense for you and your employees. Now, the other thing is that you could do all of these things and you do it really well, and you're including your employees and your management team and everyone to be a part of building this. But then where do they find all of this information? I'm sure that all of us can think of a time when we were in at least one job and we knew that there was an HR manual or policies and procedures, but we had no idea where it was. So this is something that I've heard about too, where if a caregiver eventually does go to their manager and says, hey, I'm having a hard time, can we make a plan together? And they say, oh, we actually have a policy for that, and we've got the support program that could really help you, but they had no idea, right? So it's not only just building awareness about caregiving and what you can do in the workplace and what you're going to commit to for them, but it's also about where they can actually find and access this information on an ongoing basis. So when we were building this, we were trying to figure out how can we make this really simple and easy to kind of work through. So I know I just dumped a lot of different ideas and information, but we do have some really clear 5 steps for leaderships and HR professionals as well as managers. So we're going to start with leadership and HR. So one of the things that you can do is, like I said, conduct an audit of what you currently have in place, and then what that would mean for your caregiving employees. You definitely want to build in some opportunities to check in with management. What are they seeing? What do they think could be helpful? And then how can that translate into building some of those flexible working arrangements or policies or opportunities that I just went over? So one example that I'll give here, I actually need a water break, just a moment. That's what happens when you're talking so much. So one example that I'll build in here is there is a caregiver who, didn't know what was available to them. They went to their manager and said, I'm caregiving for an aging parent. I'm starting to find things difficult for me to also balance work. And the manager themselves said, thanks for coming to me. I'm not really sure what's available either, but let me take this forward and see what we can do. And so that's one example of how it can come from the employee themselves. They're asking for this. The manager is not sure, what they can offer. So they go into leadership or HR to get some more guidance. And so from there, they were able to kind of shape a plan for a job sharing. And so what happened was 2 of the employees within the same team were able to do a job sharing agreement that worked for both of them. And then from there, they continued to kind of check in to see, is this working? Do we have any other challenges? And kind of following through the process from there. So that's how it came from, the employee and toward leadership. But then if you're looking at this ahead of time, think about what that would have done for everyone within that process. The manager would already know, okay, this is what we have available, this is what we can try. And then they're following through this process as well to review and reassess alongside HR and leadership. So the point is having some sort of like backup plan in place in case something changes with performance, or knowing how to support managers in those conversations ahead of time can really help everyone feel supported in their workplace. And also even just thinking about, how do you measure performance and success? Does this take caregiving into account? And then once you start to build some of these changes, make sure that you're checking in with managers and they're checking in with their staff teams to see if any of this is really making an impact. And then just like for managers as well, again, like building that awareness for their staff teams is crucial, because like I said before, not everyone's going to know that they're a caregiver. They're not going to label themselves as that all the time. They're not going to know how to even start that conversation at times. And so reviewing those standards with everyone is incredibly important. And then they know that you're really committed to supporting them within the workplace. The continuous consulting with staff is helpful too. Like I said, things change. I also mentioned earlier that each caregiving experience is different. So it's wonderful if you've got a policy in place, but it doesn't mean that it's actually going to be helpful to every single person. Not everyone's going to want to do the job share. Not everyone, depending on your workplace, is going to be able to have flexible hours. So it's about finding what works for each individual situation and learning from that. You can also connect employees to support. So, if you've got a certain level of support available in the workplace, there's also a lot that I'll get into near the end of today's session too, where you can point them in the right direction so they can access that. And then one thing that's really come through in this work is that one of the most important pieces here is conducting supportive conversations. So again, you show them what's available, you show your commitment, you build some awareness, but that supportive conversation is the thing that's going to go over the best with that person. It's, really something that's going to build that long-term trusting relationship with your employees. And it gives them that opportunity to say, this is what's really happening, and this is what I'm concerned about. And I want to make sure that I'm doing my absolute best here. But I'm going to need a little help to get there, right? So those check-ins and then really building that together is what people find the most helpful. So that gets into some of the tools that we actually have available. So I know this was a pretty quick run through of a very important and crucial issue and experience here, but because we just have our hour, we're just touching on this, but some of the helpful tools in place so you can work through some of this awareness building and some of the strategy building exists within our Caregivers in the Workplace suite of tools. So we do have our guide for employers, which is what we're launching today. This is our big launch. But we also have the Working Caregiving, a Balancing Act, which is a toolkit specifically for working caregivers. And we also have launched our e-learning course, Caregivers in the Workplace, specifically for employers. So you can walk through a lot of this at your own pace. It's self-guided learning. There's 3 key modules, which include real stories as well. So you can see how a lot of this is actually taking place in different types of workplaces. And it takes about 20 minutes to do all 3. You do get a certificate of completion at the end of that as well. So just to give you a little sample of, I gave some ideas of what can be done. And then now I'm going to give you a sample of what's actually in the guide. So we've got a lot of background information in there, a lot of the research that we found, and various standards that are available, whether it's through the Canadian Standards Association or international standards. They're all in that guide for you. But also we've got these tools that you can use as a template. So I talked about earlier what leadership and HR can do, looking through their policies and procedures. So we have like an assess and reassess checklist as an example. And you could take this and you can make changes to it as you need to. But this is really to help guide in going through everything and all of the different considerations that could be a part of this process. So that's one example of something that you can pull out and actually use as you start to think about what this means for you. And then I also talked about the importance of that supportive conversation, right? So for managers, especially, when you're looking at how do I even start this conversation? What do I need to be looking for? We talked about some of those key indicators around burnout, fluctuation in what people are able to accomplish within the workplace, or any changes you're seeing there. Of course, changes can mean all sorts of things. If you have someone who is really high performing and now you've seen some changes in that, that could mean anything, but it could also be caregiving. So it's one of those things to kind of notice when someone may need some support or accommodations. And then through that actual discussion, it's like, creating that neutral, non-judgmental space where you can just get an understanding of their side, what's occurring, arriving at an understanding, and then walking through what are the next steps here together. So, like I said, we've got these templates and tools. So one thing we tried to do for the guide for employers and the toolkit for working caregivers, we wanted any of the tools and templates to reflect one another, because that way you could both use your guides, your respective guides, and it would support you to prepare for a lot of these discussions, or prepare for making a next step plan once you do know what's happening together. So one example of a tool that could be helpful with this is the key responsibilities work plan. So this is a way that both the manager and a working caregiver, your caregiving employee rather, could sit down and go through this and really make sure that you're on the same page, you have an agreement in place, and then that, of course, could be used to go to HR or whatever process you have in place within your workplace to solidify this. It also really helps with what we touched on earlier regarding workplace conflict, because if a plan is in place that the employee has committed to, management's committed to, and you have all the approvals, now there's really no room for error in that sense. And the team can have a good understanding of what to expect from each individual employee. And so it really is the caregiving employees' option whether or not they want people to know about their situation. Of course, that's incredibly personal and confidential. But if you at least have a work plan in place, it really creates that key understanding of who's doing what and what you can expect from each person, and hopefully really help them to balance their caregiving requirements as well. And of course, just like we said before, you want to keep reassessing. You want to have those check-in opportunities to say, have we seen a change here? Is this helping you? So one thing I'll do now is, before I finish off here, I just want to pull up another poll. I'm just kind of curious what you're thinking after we've gone through all of this. So if you could please enter an answer there. And this is just for me to understand what you might do after today's session. The votes are coming in. Thank you so much. I'm going to give you a little bit more time there.
There's also a few questions in the chat, Felicia.
Great. Get to those in just a moment. Sorry, I'm just seeing some more votes come in. Okay, I think we can safe to end it there. So it's looking like the majority of you, just over 70%, are planning on checking out these workplace materials in the e-learning. And many of you have also reported that you're going to look at the bounce back program, learn some more about the services that we both have to offer in our organizations. And about just over 20% actually plan to take some of these back to share with workplace and colleagues. So I'm really happy to hear that. And I hope this will assist you as you continue with these conversations. Thank you for completing that. So before I get into the questions, I actually just wanted an opportunity to tell you a little bit about, okay, we've had a short period of time together. I've just given you some ideas for tools that you might utilize and some background information, but then what? So I really want you to know that the OCO is here to support you and your employees. We don't want to just give you this and say, good luck. We definitely want to build relationships with you and see how we can best support. So I mentioned that we've been working on these resources for a while. And the fact is, none of this is set in stone. We will continue to build out our resources and tools further based on your experiences with this and based on what we continue to learn within this space, right? So there's always opportunities there. We definitely could offer some information and education sessions to you, your staff, really get a sense of what your needs are so we can see how our tools can be supportive. Ongoing implementation support is also an option. One of my dreams out of this, because I'm still new to this organization and this program, but one of the things that I would love to see happen is some sort of collaborative or community of practice develop out of this, because so many employers and so many working caregivers are trying to work towards the same goals. And it would be wonderful if OCO can support you to kind of be connected with others working towards some similar goals within their workplaces. So that's another opportunity that I'll throw out there. Again, when you get our follow-up email after today, you will have instructions on how to get involved or how to stay connected and work on that. The other thing that I just want to point out is that we do have a number of support services available for your caregiving employees, or if you yourself are a working caregiver on today's session. We have a number of education and training opportunities available. We've really built out our e-learning opportunities as well. And of course, we have other programs such as our SCALE program, which is really focused on caregiver empowerment and well-being. Leroy mentioned the bounce back program that's there to support caregivers and others who are facing some mental health challenges or concerns. And so the point is, we're here to continue to support you in all of these areas. And if you have questions or any comments that come forward as you start to look at this further, I'm really interested in hearing from you. I mean that. I'd really love to know your experiences. So I have my email there. I will take these links and I'm going to put them in the chat pod as well. And the other thing is we do have a monthly newsletter. So you can subscribe to that to stay connected to OCO in general and to learn more about what we have to offer on an ongoing basis. And then that's our website at the top there where you can find all of our workplace related materials, and that will continue to grow. I also have these references. I mentioned that we've been relying on a lot of different information we've gathered, so that's available in the guide. So I will stop sharing now, and we're going to open it up for about just over 10 minutes for discussion. Thank you so much for listening, and thank you again for participating in today. Let's get those questions going here. Okay, sorry, I'm just catching up on the chat. So Michelle was asking, from an employer perspective, would it be considered part of the standard for psychological health to accommodate caregivers? What happens if, for example, an employer is not prepared to accommodate and creates unwarranted stress for an employee? So I think I just want to make sure I'm understanding your question correctly here. You're saying, like, if you make caregiving a part of your current standards, and then you don't necessarily have accommodations in place for them, will that create more stress? Well, I think that's a fair question. So correct me if I'm wrong in understanding that question, but okay, Michelle's giving me a thumbs up. Thank you, Michelle. So absolutely, like if you're going to include caregivers within your policy, you want to look at, okay, well, what's the next step out of that? So of course, like including that with any mental health strategies or anything would be helpful, because the caregiving experience is going to be different than others who need that policy. But certainly you want to think about, okay, well, once they do come to us, what's going to be what are some solutions we can have on hand? And that will certainly change throughout your discussion with that person, but you want to have a couple of strategies in place. So definitely you want to be ready for that before you make some of those policy changes, for sure. Yeah, definitely. It's a really good point though, because it's well-meaning and you want to do that, but then will you have some solutions ready for them too to support them? And that's where some of those other strategies came into place. Like if you could have like a caregiver leave policy, some of those wellness days, or, we're thinking big here, but even if you did have an opportunity for them to share some of their caseload with a fellow colleague too. Yeah, I'm just looking through. Thank you so much for that question. And Deb is asking, I'm assuming this is not mandated but recommended to employers. Is there any movement to add these policies as mandated, like accessibility? Of course, this is not mandated in any shape or form. These really are recommendations that are being made to employers. So it's based on what we're seeing, right? So I gave you those stats and the numbers that we're seeing, the amount of people that could be potentially leaving the workforce. Caregivers, as we learn from them, telling us like, this is something that's so challenging for us. We want our careers, but we also want to be able to be a caregiver. So that's where this is coming from. There are, as I mentioned, the CSA, so the Canadian Standards Association, is one group that has really worked to create some recommendations as well. So again, like nothing's mandated in legislation or anything like that, but these are some really key recommendations that seem to be popping up everywhere, even internationally. So we still have a lot to learn. I'm not sure if anything like this will be mandated anytime soon. But I mean, we've seen so many different movements happen. You mentioned accessibility. That's a huge movement that we saw over the course of several years really start to take shape, as well as of mental health, that continues to take shape too. So as of right now, these are recommendations, and I can't comment on what the future will hold for any type of mandate, but just to clarify, it is a recommendation. And Marilyn is asking if we have any workshops that offer a certificate for dementia, Alzheimer's, CPR. So we partner with many organizations. One of those is the Alzheimer's societies across our province. And so that's where you will find certificate programs and any type of information or training around dementia or Alzheimer's. For CPR, we do not offer that at our organization, but of course there's many service providers that would offer that to you. Our workshops are really focused on the specific caregiver experience and how to support them further, how they can access information. I said before too, like we want to be that one point of access for a caregiver. That doesn't mean that we're providing every single service that they need. It means that we're going to give them the information they need to access further services and connect them to our partners out there, providing the services that they're looking for. We are all about collaboration. We do not want to recreate anything or offer programs that other communities are offering as well. Okay. Thank you for that question. Benita was saying it'd be helpful to have a recording of the session to share with the leadership team. Absolutely, Benita. And Benita is a past colleague. I'm so happy to see you here. I definitely will send that out to everybody. So Leroy has recorded. We'll get that out in a follow-up email so you can share it further. And thank you so much for doing that. So we have about 5 minutes left. Were there any other questions or comments? If folks feel comfortable, you can unmute yourself too if you wanted to jump in verbally.
I would like to just say thank you for having this session. It's been very valuable. My comment about the mandated policy was related to, especially during the pandemic and seeing what happens to elderly people, not only looking at the caregivers, but what happens to people if we're not there. So at some point, it would be great for the government to, I believe, put those policies in place, because we're really helping the situation that really needs a lot of help. So I think that's very important.
Thank you so much for that comment, Deb. And one thing that's nice about our type of organization is that we are able to take all of our comments and learning outcomes from caregivers and others that we work alongside and really promote the messages that are coming through and the things people are really hoping for. So thank you so much for sharing that with us. Was there someone else about to jump in there?
I believe Michelle had one more question. Are you familiar with the Ontario Family Caregivers Advisory Network?
Yes, so I think I know the organization you're referring to, and certainly what we've been doing is anything that we create, we then share back with our partners as well. So not only through a launch like this more publicly, but also ensuring that our partners and other organizations working in the same space will have access to it. Actually, thank you for reminding me of that too, because another thing that I will note is not only do we share that with our provincial partners and counterparts and similar services and organizations, we also really work to make sure that organizations that do similar work across the country have access to it as well. So even though we don't work nationally, we want to make sure we're enabling those other partners to have this information and work together on collaborating on this area. I just saw Corey put in a question too. The expectation that caregivers are care guarantors when paid caregivers don't show up. Good comment. We need more funding to ensure there is ample care and more training programs to ensure a better pipeline of trained professionals across the lifespan. Thank you so much for that comment, Corey, really outlining all the different work that caregivers do within their personal lives. One thing that I'll just kind of, I know we're ending off in a minute, but one thing that came through when I was doing consultations with caregivers is they said, you know, caregivers really are the best people to have on your staff team. And it's because we're the coordinators of everything. And I absolutely love that comment. And I've seen that as an example, just seeing caregivers balance both worlds. And so I think it's a nice comment to keep in mind, the fact that it builds so many skills and knowledge, and you know, having a caregiver on your staff team, I mean, they're taking all of that and then bringing that and enriching your workforce, right? So I just think that's a really nice a comment that came through. But it looks like we've wrapped up our questions, unless Leroy, if I missed anything there, I think I got everybody.
Yes, it looks like there's a couple of comments coming. Caregivers are caring and giving. What more can you ask for in a team member?
It's so true. Thank you, Maria Helena. Well, thank you, everyone. Again, thank you, Leroy, and to your team for making this session happen. I'm so glad we got together today, and I'm very grateful that you took time out of your busy days to be here with us. So thank you, and I wish you all a good afternoon. We'll be in touch for sure.
Thank you, folks. Have a good rest of the day.
Bye.